My name is Dr. Rosan Meyer, pediatric dietitian from London. There is no universally accepted definition for faltering growth. This often causes great confusion. Malnutrition and undernutrition are often used interchangeably. However, faltering growth is as a result of undernutrition. The most common definition used for faltering growth is a 2 centile drop in weight over more than 1 month period, or a more than 1 standard deviation drop over the same period of time. Whereas malnutrition as defined by the World Health Organization is a weight for height or a height for age below -2 standard deviation. Whatever definition you may use, the principle remains the same, that faltering growth is a term used to pick up a downward trend in growth for that specific child. In fact, there is no difference between the definition of faltering growth and failure to thrive. However, the term failure to thrive indicates a failure in parental capacity to feed. We have therefore changed the term in recent years to faltering growth. What is very important to realize is that faltering growth in itself is not a disease state, but a symptom of an underlying diagnosis or, for example, a feeding difficulty of a child at home. It is important not to wait to start managing faltering growth. As soon as it is picked up on either the growth charts or using the standard deviation, you should start nutritional management. This is for 2 reasons. The first one is that you prevent later life consequences, and the second one is that you reduce parental anxiety. It is crucial to reinforce the importance of breastfeeding in infants with faltering growth. If breastfeeding is not sufficient, you may consider top-up feeds. These may include a high energy and protein feed, or you may also want to swap the existing standard formula to a high energy and protein feed. These high energy and protein feeds are designed to comply with the recommendations by the World Health Organization and provide the ideal energy-protein ratio for catch-up growth. Previously, the focus has only been on increasing energy intake in children with faltering growth. This has changed because studies have indicated that there's an optimal ratio of lean muscle mass and fat mass. The World Health Organization estimates this at around 70% for lean muscle mass and around 30% for fat mass. To achieve this optimal ratio of around 70% lean muscle mass and 30% fat mass, the World Health Organization recommends that between 8.9 and 11.5% of energy comes from protein in the diet of the young infant. If the child is stunted, you may actually require 15% of energy to come from protein in the child's diet. The concentration of formula means the addition of extra powder of that infant formula to the same volume of water. What happens is that you do increase the energy and protein within that formula. However, although the energy and protein increases in the formula, the ratio of protein provided within that formula is still not optimal, and it remains at around 8%, which is below the recommended 8.9 to 11.5% for optimal catch-up growth. In addition to that, the concentration of feed increases the osmolality, which in turn may lead to diarrhea and vomiting. There have also been studies looking at the accuracy of concentrating the formulas at home, and many of the parents count the scoops wrong and therefore increase the concentration beyond what is safe and recommended. The fortification of formula means that we add either carbohydrates or fats to the formula. This can be done either using oil or sugar, or can be used with specific modular products. The impact of fortification is in particular on the protein-energy ratio. It reduces the energy provided by protein to below 6%, which does not comply with current guidance on optimal catch-up growth. This is that optimal catch-up growth can only occur if protein is provided at between 8.9 to 11.5% of the total energy. In addition, it may also increase the osmolality of the feed, which may then lead to diarrhea or vomiting. It may also lead to bacterial contamination in a population that is already vulnerable to infections. Lastly, but most importantly, you need to take into account the burden on the families to ask them to make these additions at home. One also needs to question the accuracy of these additions. There are high energy and protein feeds available that comply with the World Health Organization catch-up guidelines. These feeds contain up to 50% more energy and almost double the amount of protein. In addition to that, they also have optimal amounts of vitamins and minerals that are involved in catch-up growth.